Happy New Year, everybody.
Happy New
Yes.
Year.
Happy New Year.
It's
It's nice to
crazy
be
how
back.
I know and how quickly we're all back into the swing of things. January is a fun month to start and think of things a little differently. And I'm so excited to learn more from Joe today. I think this is a really great topic, definitely something to kind of get all of our hygiene brains thinking about as we start talking myo today. And we've got a very large group joining us. So I'm so excited about that.
Well, I'm absolutely excited to be here. I think this is my second RDH View,
Uh-huh.
Yeah.
It is.
but
Yeah.
now I've earned
Now
a
you
mod.
Yeah, now you're
Now it's official. Yeah.
Exactly.
It's great.
It's-
All right. We're
it's
just going to
awesome.
give it a couple minutes here. I see all the people pouring in. Okay.
Maybe in the chat, tell us where you're from and if you have snow, how much.
Ooh, good question.
So we just got a nice little dusting to make it look much brighter than the gray days we've been having.
I
So
know.
that's great.
My kids were very disappointed being in Port Perry, kind of in the country, that their bus was not canceled because some of their friends' buses were canceled and they were very upset. They're like, we shouldn't have to go to school. I'm like, yes, you do. Your bus is not canceled. You will be heading to school.
Joe, tell us how
Look at these weather reports here. That's fantastic.
do you feel about the snow, Joe?
Oh, I'm not a fan. It's a running joke. My daughter and my partner bought me snow pants one year for Christmas, and I've never used them.
Oh.
I'm
I'm going
Yeah.
to just keep posting beautiful
Canadian.
scenic pictures of like up north, and I'm just going to tag you in every single one of them forever.
It's very pretty. Don't get me wrong. It's pretty to look at, but yeah, no. My retirement goal is to not see the snow ever again.
So it looks like over in BC, there's no snow, yet you get Alberta, there's freezing rain. And then as we go all the way over to Quebec, they're getting like freezing rain and snow. So we'll stay in Ontario in our just snow section at this point. How's that?
We do live, we're very fortunate in Ontario in that we don't get the extremes, I find, especially in the GTA where I am. I'm in Mississauga,
Mhm.
so we just don't get the extremes. There's no hurricanes, there's no major blizzards. We bypassed all of that stuff before Christmas. It just didn't hit us at all. So it's kind of nice. But I still don't like it.
So Joe, there's a shout out for you. I don't know if you saw that in the chat, 'cause there's lots of stuff coming in there, but one of the viewers took your course in November and is starting to implement the program this week in
Oh,
their
amazing.
practice. Yeah,
Oh, amazing. Hi, Sue.
there you go.
Yeah, that's great. Sue is fantastic. It's exciting. Yeah,
Yeah.
the crew that I've had in the programs, I think I've run 3 now. They're
Mhm.
all, they were all just so like they were sponges wanting the information because I go through a lot of information in the program, and because it's 30 hours of learning and it's 10 hours is online, and it's a lot of information to take in. Some of it is somewhat review of what we learned in college from an anatomy perspective, right? So, but it's the important anatomy that you need to know when it comes to myofunctional therapy and the oral facial complex. And so it's kind of dry at times, but it's just absolutely imperative that I go through all of that stuff in order to understand what we call normal. Everybody that knows me knows I don't like using the word normal, but what we understand is, anatomy and physiology, and then the pathophysiology of it all. That's the learning portion of that is kind of, it's exciting to learn the stuff that we see every day that's not ideal anatomy and physiology, right? And so
Before you get going too much, I think we should actually officially do an introduction. Okay. So for those of you that don't know, we have the fabulous Joe joining us today on the RDH View, and we are so excited. He joined us last year when we talked about independent practice. And Joe, I know I could read your bio, but I would just like you to sort of introduce yourself, share a little bit about yourself, and then we'll officially get started talking about this awesome topic, myofunctional therapy. So take it away, Joe.
So my name is Joe Siegfried. I work in Toronto. I have my own independent practice, Kingsmill Dental Hygiene, and I work as a myofunctional therapist in my practice. I've been doing myofunctional therapy for 8 years now, 8 years. My learning is extended beyond sleep, TMJ therapies. I work heavily, my practice consists of kids and adults alike. I will say that I have a heavier base of practice is adults. I get a lot of sort of middle-aged sleep apneics, although I'm not treating sleep apnea. The therapy itself has an incredible effect on sleep apnea. So I've been doing it for 8 years, and now I've been blessed to teach it to other dental hygienists in Canada.
So do you think you could give us a snippet? I know we don't have that much time. We've got lots that we want to try to cover, the key points, but could you highlight how dental hygienists can improve their practice by learning about the myofunctional therapy?
Well,
And if I could interject for 1 second, we're just sort of working backwards today. I just didn't get a chance to go over just some of the housekeeping for today. So Joe, if you could memorize that question that you were just asked, that would be perfect. For everyone else joining us, as we sort of alluded to earlier on, this is a really exciting topic. So we have a really big group today, one of our record-breaking groups. So we highly encourage, chat and Q&A. If we don't get to your question, please don't take it personally. It's just because, again, we have so many of us here and we're all so excited about this topic. So please chat with us, ask your questions. And then if we don't get to that question, we'll give you a method at the end to find an answer to those questions. So please use the chat just to sort of talk back and forth, like nice shirt or whatever you want to say. But if you have a question, you're looking for an answer, if you could put that into Q&A for us, that really just helps us out as far as managing that part. On a personal note, I'm, like many of us, just so excited for today. And I really do believe that if you are given a chance to publicly acknowledge someone who means a lot to you, you take your shot. So Joe, we are just so thrilled to have you at RDHU. Thrilled to have you as part of the dental hygiene community. And I'm just excited to see all the things that you're going to do to just push our profession even more forward. So thank you for being here for us today.
Thank you, Beth. That's very sweet of you. So the question that Carrie had was, how can a dental hygienist improve their practice by learning about myo? So I use the terms myo. I'll use a variety of different terms, but the short form is myo. And it's really not just the therapy itself. It's really the ability to be able to educate clients and find answers, because that's what we do. We're preventative specialists as dental hygienists. So, I mean, for example, we don't all know how to do a root canal, right? We don't do root canals. It's not in our scope, but we know how to describe that to a client, and we know how to educate our clients on why a root canal might be necessary or a crown might be necessary. So the benefits of understanding the implications of airway obstruction and the importance of nasal breathing and a proper swallow just enhance what we can do for our clients. So you really can bring value to your overall, we talk about systemic health and the various effects of periodontal disease on systemic health, but we don't talk enough about airway obstruction and nasal breathing, what that has to do with systemic health. So that's really how a dental hygienist can actually improve their practice, by understanding why someone is possibly grinding their teeth, understanding why that patient might have, or client might have, the anterior maxillary inflammation constantly because they're a mouth breather. Why that white coating is on the tongue all the time, because their tongue's not at proper oral rest. That's sort of, it just improves your overall assessment and the ability to enhance your clients' lives, really.
Okay, so if a dental hygienist wants to bring Myo into their practice, like, can you outline, what that process would be? Could you outline it as if you worked in a GP office and versus the different approach you might take as you did in implementing it into your own practice?
So in a GP, so I worked, when I began Myo myself, I started in a GP practice. So of course, you really start with educating. And again, that's what we do. That's a main part of what a dental hygienist does. So if you're working in a GP practice that understands and knows the connection between clenching and grinding and obstructive sleep apnea, for example, lots of dentists and lots of GP practices do oral appliance therapy. The outcome of that GP's treatment is going to be improved by myofunctional therapy. So everything that the restorative that happens in somebody's mouth, if you can actually decrease the amount of clenching and grinding by addressing the obstructive sleep apnea with myofunctional therapy, or addressing the oral facial malfunctional disorders that will actually improve the sleep apnea. Sleep apnea is associated with clenching and grinding. So because it's attached to an airway obstruction. So it really does help if your dentist is on board with that kind of understanding. But if they're not, you begin with educating and you start to learn and educating. So you've got, 20% of your patients in your practice aren't wearing their night guards. They're plain bruxism flat splint night guards. Why don't they want to wear them? Because they probably have an unaddressed sleep breathing disorder that's not been addressed. So it's not necessarily the right appliance for them. So, and that's what you can bring to the practice in terms of in a GP practice. To make it work in a GP practice, it does help that if you have a treatment room, in terms of being, that's how I teach it. It's best not to take away, obviously, from hygiene production, but it really does improve it brings value to the overall practice, and it will absolutely improve other treatment outcomes for restorative, for ortho. It will help prevent any kind of ortho relapse. It'll actually help prevent any kind of, it'll actually speed up the orthodontic process. I have a lot of the orthodontists that refer to me are looking to close the bite. That's something that I get a lot. They're trying to close the bite and they're fighting that thrust pattern that's there, and they're fighting the anterior open bite, and they just can't get it closed. So that they end up in my chair. Of course, just like a restoration, healthy gums and no bleeding will give us a more solid foundation for a restoration. So it's the same thing. With the tongue in proper oral rest position and the lips not fighting the lips, it'll be easier for the dentist to do the work.
So Joe, why did you start Myo? Like what was your inspiration?
So at the time I was working in a practice that we worked with sleep and TMJ clients. That's kind of where I began my whole process. And we ended up having, I attended a seminar from one of my mentors, and I had no idea what myofunctional therapy was at the time. And it was this big aha moment for me, where it was the clients that we just couldn't seem to address their pain, or they just weren't progressing in the therapy that the dentist was doing. And it was a strong aha moment where I thought, oh wait, this is what's going on with Sally. She's got a thrust pattern, and we can fix it. And then I started seeing it in my daughter, and that was really the bigger picture for me. And the program that I do, the little 6-hour program, the intro program, I talk about my daughter a lot in that. And the inspiration for me was seeing my daughter My daughter was 5 years old and fell asleep in the dental chair, getting fillings. 5,
Wow.
because she was just exhausted all the time.
Mhm.
And I didn't know anything about myofunctional therapy then, but I started learning about airway obstruction. And I realized that her massive tonsils were cutting her airway off every night. So I think we as people and as humans want to do better for our kids. And that's really where it came from me. And the ability to do something that's so non-invasive, but absolutely change somebody's life for the better
It's
is
huge.
healing is really, I mean, obviously it gives me, it gives me it gives you a good flex, right? You feel good about it. And that's what we do. We don't get into this business to not make people feel better and not make people healthier.
Mhm.
So that's why I do what I do. So my inspiration I get my inspiration daily from my clients. That's a big part of it. I get huge inspiration from everyone that does this across the world. I'm connected to people all over the world that do this, and you see the changes that happen. And when it's caught early, you can absolutely change the direction of somebody's life.
It's huge.
Awesome.
Yeah.
But really it came my kid. It's really my biggest inspiration in the beginning was probably my kid and the clients that I was seeing at the clinic.
It's amazing when
That's
you
awesome.
talk to so many different dental professionals, how a lot of that inspiration comes from that key person. It's usually a family member that starts you down a journey because you were looking for more, or you were just, not that you're questioning it, you just want more of an answer. And so I'm glad that you shared that story with us, because I think that that's really why a lot of people should kind of go down these different journeys. And you've kind of blown my mind on a few things. I've been like writing down some notes. I'm like, okay, like the tongue coating, and that could be related to ill position of the tongue and all these things. I'm like, I need to sign up for your course so I can better assess my patients, and I see that and I write it down and I make notes about it. But I personally want to learn more about these aspects. So there's a little tidbit for that. But yes, thank you for sharing that personal story, honestly.
I agree, absolutely. And I think you've already touched on a few things that Myo can help with, like when you're talking about the positioning of the tongue. I'm very curious just to hear a little bit more about sort of the other areas of myofunctional therapy, like what specifically it's helping to treat. And maybe while you're answering that, there was a great question that just came in, and I have a feeling there's going to be other people who could benefit from the answer. Do you do some of your appointments, or all of them, virtually? So if there was somebody in BC or somebody in Alberta who was looking for someone, are you available for online? 2 questions in one there, Joe.
Sorry, what was the first part of that question?
The first one was just more information about what Myo treats. So
Okay.
That was the main question.
We treat the myofunctional disorder. As dental hygienists, it's not necessarily it's not in our scope to treat sleep. And I've articulate this a lot, and people, it's like I'm a broken record, because we have to be careful about what we're treating and what we talk about what we're treating. So I do often, people get a bit confused about it because, can you treat sleep apnea? Well, does it affect sleep apnea? Yes, it actually reduces your apnea-hypopnea index by 50%. But I'm not treating sleep apnea. I'm treating the oral facial malfunctional disorder that in turn reduces your sleep apnea numbers by half. So it can improve sleep apnea. It can improve headaches, TMJ pain. It will reduce neck pain. It can help correct forward head posture. All of those. I'm not a posturologist. It's not what I do. It's not in my scope. But this is connected to the rest of our body. And the idea, and I say this a lot, people who've taken my courses will have heard this before. Put everything in the right place and things work better. So put your head over your shoulders, over your hips, over your knees, over your ankles, and support that by putting your tongue on the roof of your mouth. Everything will work better. But it's not just sticking your tongue on the roof of your mouth. It's making sure your lips aren't being used more than they need to be. making sure you're not using all of this other musculature to swallow.
Mhm.
You're using that. Why are you using that? I'm a big why guy. That's why is my, I want to find out why. And sometimes you don't always get the why, but it's the same because it's a progress-based therapy. If people aren't progressing, why? So we in turn figure that out. But my main, my main client base is they come to me for pain management, sleep, TMJ, and headaches. Those are the four main things that people come to me for. And does myofunctional therapy have an effect and alleviate all of those things? It can. And that's the wonderful thing about myo, because it's so non-invasive. But people have to put in the work. That's a big part of it too. It's work. It's like any kind of physiotherapy. Your shoulder's not going to get better if you don't do your physiotherapist assigned therapy, right? In terms of virtual therapy, I do virtual therapy. I don't love it. Personally, lots of therapists do virtual therapy, and there's absolutely nothing wrong with it. My personal choice is when the pandemic happened, we all shut down, everything closed off, and everything went online. I did 4 assessments online, and I just could not do them again because I put my fingers in people's mouths. I have learned, part of my learning process is to learn how to feel muscles and assess tension in muscles and assess where there might be tension in a muscle because it represents them being a grinder and a hunter. So I really like to feel. I like to feel the TMJ. I like to do that palpation. It's like my extra and intraoral exams are important to me. And I couldn't get great photographs from people. My photographs are really important. I learn a lot from my photographs. So I request that my assessments be done in person for sure. But I will absolutely do an online therapy itself because we're not touching the client. It's all mimicking and teaching. I do, it's not that I wouldn't do an assessment online. It's just, it has to be nice and bright, and I have to be able to see what I'm looking at, and everybody's cameras are different and everybody's lighting is different. So I just found it challenging personally, but lots of people do successful therapy online.
And you're measuring openings and things like that. So it's
just the tools that we use to do an assessment it's just so much handier to do. Like it's just not the same. It's like trying to it's like trying to take somebody's periodontal measurements online. You just can't. I just can't.
Right. So what if it's a case of someone being somewhat remote or just too far? I totally appreciate what you're saying. The ideal is in person, but if there is somebody who it's just not feasible, is that then the next best thing?
Absolutely the best thing. Then you do your absolute best with online therapy, because you will make that difference. That's the thing. It's the same with hygiene. We do the best we can with the tools that we have. And the ideal, you have a chair that's not the best chair on the planet, but you can still do your therapy. It's the same thing, right?
And I'm going to say, and if you're talking about the dental hygienist who's in BC who would like to have her son seen by you, maybe you could coach her for the assessment.
Yeah, well, that's true. That's true. Absolutely. And that's absolutely doable, especially if there's somebody in the industry who understands what I'm talking about. Having a parent, if I have a little one and then they wanted me to do an assessment online, and having a parent try to figure out what measurement I'm trying to get is really difficult.
Right.
For sure. Can you demonstrate? I'm just now curious because you're talking about everything that you do, and you talked about them actually feeling muscles and things like that. For instance, when you are assessing like for a tongue thrust, is there a way to show? I know it's probably more involved, but what exactly, like, what are you looking at in that specific
So
situation?
the thrust pattern, it's very easy to do a thrust pattern, to check a thrust pattern. If you have somebody, you can get some cheek retractors, which we all have, and have somebody try and swallow with their lips open. Everybody do it now. Big smile and try and swallow. The thrust pattern, you'll see the tongue pushing and saliva will come out into the vestibule. That's all relative to a thrust pattern. Okay. I should have given you a video. I just took a video of a little one that it was incredible. Like he could not, I had the retractors in there, and as I try to take a little video while I'm doing my photographs, and he's holding the retractors, and I had mom hold the retractors, and I said, okay, swallow. He flipped the retractors out of his mouth. His thrust was his tongue came out between his teeth and his lips pulled in so hard because he didn't know how to create a proper seal in the back of his throat, in his mouth.
Oh, wow.
So it's a reverse swallow pattern. There are more obvious thrust patterns that are significant, but when you do a retracted swallow, that's when you see it. That's the easiest way to see it. The other thing that you're looking for, I say this all the time in every client that sits in my chair. Our swallows are supposed to be secrets. We're not supposed, I forget, it's a quote from somebody I've learned from, but we're not really supposed to see ourselves swallow. So when you're looking at a swallow pattern and you've got somebody who swallows like this, they're compensating. So even at minimal, so there's a few reasons that can happen. It means they didn't chew their food enough, which is an orofacial malfunctional disorder. Okay. We don't chew our food enough. Or they're compensating in their swallow pattern because they have a reverse pattern and they're bracing against their teeth, which is a thrust. And so imagine, even slight, not even with food, imagine swallowing your saliva all day, because we do, but doing this ever so slightly all day. What muscles are you affecting? All of these. So all of those neck muscles and all of these, your platysmas, all of those, that musculature that we shouldn't really be using during a swallow, get overused, and then they get fatigued and tired and sore. So what we look for are perioral muscle use, this tension in your swallow pattern. And a majority of this is affected because, why do people have thrusts? That's a good question. People have thrust patterns mainly because of bottle use. We're giving bottles far too long. Bottles and pacifiers are supposed to be used as transitional items. An infant a baby shouldn't be given a bottle for much longer than maybe 2 feedings a day. And we're given bottles. It's a North American thing, to be honest. Well, I mean, it's all over the world, but we use bottles far too long for our kids. And our kids are given mush. I talk about this all the time. You've all heard this before, but our kids are given mush to eat. Kids don't even have to do hand-eye coordination anymore. They're in little tubes that they squeeze. They don't even have to put a spoon in a jar anymore. So those are the things when I'm doing an assessment, I immediately can see a swallow pattern. I have a client I did an assessment on last week. She's a woman in her 60s and she's an anterior open bite. And that's why she came to me. She's come to me because she's like, my teeth are apart now. They've always been apart. And so I can't necessarily solve that anterior open bite. But as soon as we get the tongue out of there, they may over erupt and meet again. Actually, I have a case study in one of my courses that she's an anterior open bite. But she swallows and she has a significant compensation. One of the things that dental hygienists can learn from even the introductory course is taking things like the tongue range of motion measurements and keep bringing that as part of your assessment. Pretty like just clients that one of the main things that I look at, another part of my assessment is whether or not a dental client can create a suction on the roof of their mouth. Can they even get their tongue on the roof of their mouth? A lot of them can't. I actually use balloons. I just started using balloons as part of my assessment. Blowing up a balloon, if you can't blow up a balloon, it's probably got something to do with your tongue and your airway.
It's so fascinating, you know, and you touched on you touched on sort of the nutrition aspect of it, like kids eating mush. And it's such a fascinating study on sort of the epigenetic changes, right? Like historically, kids, there were no blenders. So we weren't putting bananas in Blendtex. It was like, here's a mastodon bone. Have at it, right? So we start to see those. It's just fascinating when you start to look at how those changes have actually changed our facial features.
Well, and that's, I mean, again, we're living longer, which is great. But there is research that shows that, like, anthropologically, in all of our changes in our facial structure and our facial development started in the mid 17th century when industrialized society, and we started crushing wheat and making bread and that's really when it started. That's when our skulls started really changing. And we stopped having 32 teeth. I mean, think about that. We're supposed to have 32 teeth. But we've normalized taking out all of our wisdom teeth. It's like, oh yeah, I gotta have my wisdom teeth out when I'm 18. But why? Because your face didn't grow. And some people aren't, we all know it. We all see it in our chairs. Some people aren't even getting their wisdom teeth. And that's the epigenetic factor. That's where we are changing ourselves genetically. It's really neat.
Well, Joe, I think you have like totally mesmerized us, and we all want to know more, but can you relate it back to the business aspect? Like, how does the billing work, and is there insurance? Because of course we're going to have to deal with all of that as well.
Right. So insurance wise, so billing, there's dental codes in every fee guide. So there's codes in the Ontario dentist, or the dentist fee guide.
Yeah.
Everywhere. And there's codes in the independent dental hygiene fee guides. So billing is, and you bill what you want to bill, essentially. There's a value to each unit, and it depends on how many units you're spending. Usually my visits are about 45 minutes long. It also, you have to kind of survey your market. You know, if every myofunctional therapist in the area or in your province is charging $25 for a session, then you might not get a lot of business if you charge $150. I mean, it's not $25. But essentially, insurance-wise, I'm not an insurance-based practice. So there are literally thousands of insurance plans issued under various policies and carriers in Canada, and we all know this. An insurance company should not be the driving factor of whatever treatment you're recommending. And we all know that, but we live in a world where people rely on their benefits programs. Should a client like to inquire if they have coverage? You can, of course, send a predetermination out prior, or you can provide the client the details so they can inquire themselves. It's more common that I found certainly in Ontario. Can't speak for other provinces, but it's definitely more common for children to have therapy or coverage than adults. I generally tell my clients not to count on getting insurance coverage from it. If they have a healthcare spending account, absolutely, they can bill it through there. But the billing is just like any other service that we provide. And you determine the value of, I charge a little bit above fee guide personally, but not significantly above, and it's market value for where I am essentially. I like to keep it accessible. Some people don't, some people say I don't charge enough. But my whole goal with therapy is to make sure people find out about it. So I want to make sure it's accessible.
So can I ask you just a little bit more about maybe the billing or the structure and again, the business side of it? So in each fee guide, there's a section that, is it actually specifically saying myofunctional? Because I know for lasers and for other things, there's not actually like a code that specifically says one thing or that. So there's a myofunctional code for people to go and
Yeah.
review depending on where you're practicing and in sections. So that's really, really awesome to find out. And then from there, they can predetermine how many appointments does it take, or is it's client specific or patient specific? I know that that's going to be the answer, but on average, is it sort of like people are looking at least 4 appointments or 5 appointments to kind of ensure we see change?
So I was taught the whole as a program of 15 sessions and 15 weeks, and this is what it is, and you charge this. And because it is client specific and what we do and the way I teach it is client specific. So with my adults, my goal with my adults is to give them everything they need to know and educate them enough that they know how to move forward with it. So with adults, it can be there's an intensive phase of therapy, a maintenance phase of therapy, and then what we call habituation. The intensive phase of therapy with my adults can be anywhere from 4 to 6 sessions, and that can be over a 3 to 4 month period. It might be every 2 weeks. It might be every week in the beginning for a few of them. If a client needs to have their tissue addressed, they have a tissue restriction, we work it into their therapy. So that adds a couple of appointments for post-op, but anywhere from 4 to 6 sessions, and then anywhere maybe another 2 or 3 or 4, depending on progress. Again, because it is progress-based therapy, and I tell all of my clients this, if you don't do the work, it's going to take longer, right? It's like bleeding gums. If you don't start flossing more, they're never going to stop bleeding, right? So it is progressive-based therapy. And with kids are a little bit different. I give them less to do. I see them weekly, usually for about 6. I usually see them anywhere from 4 to 6 weeks weekly. And I give them a little less to do. And then I see them every other week for maybe probably another 4 or 5 sessions. And then might be monthly for once here, once there. It depends on, sometimes I halt treatment because somebody's putting a palatal expander in. So we hold on treatment for a bit. And they have a couple of maintenance things that they have to do while they're in expansion. So it does kind of vary. We work together as a team when we work with orthodontists and other practitioners. Financially, I tend to have people commit to my intent. A lot of therapists do this. I have them commit to the intensive phase. So if I've treatment planned 6 intense sessions, I have them commit to those sessions and pay for them because I want to know that they're committed to treatment.
Yeah,
That's good.
that makes sense.
And are they with you like for a half an hour, or what? How do you schedule? I book
an hour, but my appointments, they're sitting with me for about 40 minutes. I book an hour because then I have the pleasure of working in my own practice, so I can do what I want. There's just like our dental hygiene world, there's templates that you can create, and so I spend a little extra time doing my notes in that hour time, but usually about 45 minutes is more than enough. With the little ones, I usually only book about a half hour because I'm not giving them as much to do. So that's in the schedule. From a schedule perspective, it's an hour or 45 minutes or half an hour minimum. And do you find that a lot of your clients are, being referred to you for myofunctional therapy, and then also you'll have your own clients who come to you as a dental hygienist, right? And then you're saying to them, we could do this, this, and this. Yeah, so it's part of my assessment. It's part of my sort of dental hygiene clients that come in. It's part of my initial assessment. It's just part of my hygiene visit. I don't barrage them with everything that's going on at once, but they start to learn about tongues and what might be going on in a swallow pattern and how they use their lips in my initial hygiene visit. And then the other, I would say about 50% of my client base for myo is referral. So I have
Nice.
dentists, I have orthodontists, I have massage therapists, I have physiotherapists, I have one sleep physician that sends me clients.
That's wonderful.
Yeah, it really does. You sort of create your network of people, and that's
How though? How did you do that?
Yeah.
Like, how did you?
That's part of the work of it. That's part of having a referral-based practice. It's sending out those, little candy baskets at Christmas. It's all of that. It's part of it's being in. You have to start to meet people. You have to attend lectures. You have to sign up for that 1 hour webinar where somebody's talking about something. I signed up years ago. I remember signing up for a 1 hour webinar for the swallowing lab at University Health Network. And I was, of course, the only dental person there. And the person doing it was like, why are you taking this? So
Wow.
you have to sort of seek out those things. And of course, now that she's an SLP, that refers to me. Like we stayed connected. So you do have to do a bit of work that way if you're looking at doing it as an independent practice. And even in a GP practice, your GP will have their own network. You'll have a base of clients that are already in your chair. But if you want to bring more value to that practice, you have to put in a little bit more work to expand out. So you're going to talk to the orthodontist that you work with. You're going to talk to the, if you're a dental hygienist that sees an RMT, talk to your RMT. That's how I started with. That's how I started with my massage therapist that referred to me. I was getting a massage a number, 8 years ago. It was in the very beginning, actually, we started talking about it. And then he came to me and saw me for therapy, had a tissue release, and now he has 4 or 5 RMTs in his practice that refer to me. So it really does, you have to put in the work.
Well, it's education, just like you said in the very beginning.
Mm-hmm.
I get a lot of why don't people know about this? And that's the reason people don't know about this, because we need to educate more. And that's why I do this stuff. That's why that's why I ramble on so much about it.
And I'm just thinking too, like for someone starting off, they could always offer a free workshop and have different ones, one for the public and one for other healthcare professionals. Whether it's come and see my clinic, or I'll meet you on Zoom, right? If you meet, this is how we can work together. And
so each professional organization, each profession has their own sort of, just like we have our hygiene societies, each profession has their own societies, and they're always looking for new, different things to learn about. So for me, in the very beginning, I put together a little 45-minute talk.
nice.
I went to, I did a speech language pathology society. I did a learning program with some chiropractors. Like I was in one night. This was pre-Zoom, obviously. So you do you can do lunch and learns if you're in a smaller community, you can do a lunch and learn with the medical office that's there. They'll have clients that have sleep apnea. They'll have clients that have pain. And you might not get 20 referrals from that one doctor or that one physiotherapist, but when they have something that they can recognize and go, wait, my therapy is going to be improved, possibly by sending, I don't know if this has anything to do with it, but maybe go talk to this dental hygienist. That's what I get a lot. Like they think it might have something to do with it. And it always, 90% of the time it does.
It sounds like the best way to go about implementing this is to create some sort of business plan. And it's not just going to be, I'm going to sit in my chair and the patients are going to come. You've got to do awareness. And part of doing awareness is a way to brand your practice, brand your independent practice, your GP practice. There's lots of opportunity. And from just being out there and open is part of the option. And not only that, but your clients, your patients, whichever way you refer to them, are excited to hear this information. And, we talk about this on the show all the time. You've got to give your patients, your clients, the information that's there. You've got to pass on this knowledge, whether you can do it or, hey, I was at a course and your tongue, that coding, we got to figure this out, because that doesn't seem, as ideal as we would like it. Not normal, right? We don't use the word normal, right, Joe? But, as ideal as possible. And bringing this forth, I think that's so fascinating. So there are tons of myo courses out there, not tons, sorry. There are not tons of myo courses out there, but there are some myo courses out there. I know that you offer, the program. Can you tell us a bit about your program and why it's a bit different than others?
So when I took my initial program, because I've done a number of courses since, but when I took my initial program, it was taught, I was in a room with 45 people.
Mhm.
And there were orthodontists, there were dentists, there were dental hygienists, there were occupational therapists, there were osteopaths. One of the reasons my course is a little bit different is I teach specifically to dental hygienists. One of the reasons I do that is because when I left my program, I had no idea how to work myofunctional therapy into the process of care.
Mhm.
No, I had no concept of, okay, so I know how to do this. I think I know how to do an assessment. How do I make it work from an ADPI perspective? And diagnosis, dental hygiene diagnosis and evaluation. So I really even just from a charting record keeping perspective, none of that was provided to me or given to me. So I really had to rewrite the chapter, right? So my program is specifically designed for dental hygienists and dental professionals so that they can follow the process of care. So we go through assessment, we go through dental hygiene diagnosis. Every case study in my program has a dental hygiene diagnosis attached to it. And then goals, client-centric goals. What does the client want? Is it I've told Carrie that she has a tongue thrust. This is part of my assessment, but does Carrie care? Right? So that's what that's why my program is very different. And I've had people who've taken other programs come into my program because they often leave their programs not knowing how to really, where do we go from here? So, and I talk about how to implement it into practices. That was not something when I learned it, I was taken back to practice and said, okay, go. And I had no idea how to fit it in.
So it's really application based then.
Pardon me?
Like it is you take ADPI and then you put it into an application based approach that makes it really transitional easy for the dental hygienist, because this is how we're trained.
Yeah, and I give templates on chart notes. I give templates on assessment. I give templates on reportings in my program because, and you don't have to use any of it, but at least gives our dental hygienists and the people who take the program a guide to start. And part of the other thing that when we do learning, we always have in the back of our head, okay, this patient, if it's that client, it's that client, so this, I'm going to take this back to this client. I now have incorporated into my program that the students come to RDH View in Burlington with their first client, but they've done a bit of an assessment. So when they leave my program, they're not taking this and leaving the program and going, okay, and not doing anything with it. Because that's something that we are all kind of probably guilty of. We take a course and we loved it and then we don't implement it. And so I kind of somewhat force them to implement it. So they're using it.
And your practical program, so you have the Mysteries of Myofunctional Therapy, which is a 6-hour introductory program. So for those who are just interested in learning a little bit more about myofunctional therapy, that's a great program. And then from there, those who want to embark on the whole journey, go and take the practical program, and that 6 hours is a prerequisite, right? So then you come for the 30-hour program, and it's online, some of it, right, for however many weeks,
I think it's 10
and then 10
7.
weeks online,
7 weeks. I can't remember.
seven, and then you come to RDHU for the 2 days of practical.
Which is really
And I
fun.
was, yeah, it is fun. I was there for your last one, just for the Saturday, and everyone's like, during break and that, they were all just like, oh my gosh, my mind, like there's just, I can't wait to get back. Everybody wanted to run out and
It's pretty
take
exciting.
action. So
Yeah.
mhm.
And we've had people from across the country as well. So we've tried to, I know this was very strategic on your part, Joe, trying to make it feasible for everyone. So there's a portion of it, like you said, that's online. And then we have people driving in and flying in for the full weekend of hands-on. And it's just such a fun, you've made it just such a fun and interactive event.
It's really, for me, doing this at RDHU has been really great because I'm connected to people in Manitoba and people in Saskatchewan, and it's like because I mentor after the fact, I continue that first case. I try to make sure that I'm on them so I don't always get the feet necessarily that they need me, but for example, I'll be sending out this week, actually, I'm going to be sending out to the last group, show me your cases, and they may not respond yet, but it just depends on where they are. But I try to continue and push other programs, and they all become part of sort of my network, and they get resources and information and other courses that other layered learning that they might not necessarily be able to find. That continues.
Yeah, because
Sorry, go ahead.
it's like, like you say, like you're encouraging. So when you're mentoring, they're part of a Facebook group, right? So you're there together so that you don't feel like you're alone. You didn't take the course and that's it, it's over. But then it's one of those things that there's so much out there, different aspects of it, that you encourage them. There's this course here, there's a course there. Like when I look at yours, like you did the Introduction to OMT, Academy of Orofacial Myofunctional Therapy, 28 hours. Breathing re-education for myofunctional therapy, 30 hours. Mastering oral myofunctional therapy, 15 hours. And it goes on. So it's like, it doesn't end. You don't just be like, high five, we're done, right? It's like because then you just get so excited and you want to learn more and more as well, right?
There's always more to learn with this, and there's different. And the nice thing about the groups and being connected and being part of a network is you learn from each other. And I say that in most of my courses, like I don't know everything. None of us know everything. I'm not, so, and ignorance is not a bad thing. We think of ignorance as being, this horrible word, but it's not. Ignorance, not understanding that you don't know something is the first key, right? So the best part about the network that we have is that because some people are coming at it from ortho, some people are coming at it from GP, some people are coming at it from independent. Everybody has a reason that they've decided to do this. And I get information from people who are in ortho through the group.
Right.
It's great. And one of the reasons we did the intro course, the little 6 hour as the prerequisite, is because it's a big investment. The big practical program is a big investment, and the 6 hour program gives you enough information to really understand whether or not this is something that's going to be that you want to be as part of your practice. And it's the smaller program allows a dental hygienist to be able to start screening.
Right. And refer out to a myofunctional therapist if they don't want to continue on, right? That's
exactly.
Yeah. And then we've gone through the process with in Saskatchewan and in Manitoba, so that we can, this is like you can't just start on a 6 hour. You have to have this practical program in order to start to offer the service.
Yeah.
And one of the reasons why we did it, Joe, if you remember back, it's like was it just before COVID or during? But it was like there wasn't really anything in Canada, so that's why we're like, let's get this going in Canada, because everybody was going to the States. And then the first one you did, everything was online. right?
Yeah, it was the very
Because we
first
weren't
one.
allowed to be together.
Yeah.
Yes.
Yeah.
Yeah, no, it was interesting to be all online. It was great. That group was fantastic.
Oh
Mhm.
yeah.
We're all fantastic, but it was
And one other thing I want to mention is that wonderful manual that everybody gets. Like it's like an 800-page manual. It's this huge binder of everything you need. It's like you put so much effort into this. So congratulations and
Mine-
thank
Yeah.
you for sharing your knowledge with all of us. It's
For
amazing.
sure. Yeah, we're very proud of everything that you've done.
Mhm.
And it's obvious through the number of questions coming through, and everyone has been waiting so patiently for me to get to their questions.
Okay.
Joe, there's no way for us to get through them all. Do I have your permission to share maybe your email address in the chat just before we close today?
Yeah, it's the myotherapy at GP myotherapy. One sec. I just want to make sure that I have it correct. I have a few emails. So it's myotherapygta at gmail.com.
Myotherapy GTA, myotherapy GTA. Yes, at
gmail.com.
okay, coming at you in the chat here, everyone.
And I think I might even take a little snip capture of the questions, and let me just see. So we have them. If we can't get to all of them.
I think one that keeps coming, one that you've already answered that kept coming up was about your program. And oh, there's just so many questions. Honestly, Joe, I'm sorry. We're just gonna have to give your email address. Do you know, someone was asking about like applying to different offices. Do you find that there are roles right now that are just, you are a myofunctional therapist in an office, or do you find it's usually sort of this hybrid? How are you seeing that sort of coming into play?
More common to see it as a hybrid, but if someone is looking for a myofunctional therapist, it'll be there are ads out there that have it as a requirement, and those are usually the sort of more airway focused dental offices out there. But it's not on all it's not on a lot of GPs radar as much, I would say. But if you're looking, but it's definitely become, I've noticed it more. I don't look at ads very often for dental hygiene, so I don't really know the answer to that question, but it's definitely, I have had requests sent to me by other dental professionals, dentists, and orthodontists, if I know anybody who may be looking for a job.
Mm-hmm.
But it's usually somewhere I don't know the person. It's happened 3 times, but it's in an area of the world that I don't know somebody. So.
I have toyed with the idea of, I'm sorry, I'm putting you on the spot with this. This question is going to open a can of worms. Joe, you have a unique experience with, and just tell me we're out of time if it's not a good question. Being a certified, because I get this question about lasers too, being a certified myofunctional therapist, so putting sort of a credential. Do you want to speak to that kind of large question?
Yeah, it comes up a lot. So
it does.
So can you put certified orofacial myofunctional therapist behind your name after taking my course? You can essentially do whatever you like, but the COM acronym, which is Certified Oral Functional Myologist, that is owned and trademarked by the International Association of Orofacial the IOAM in the States. So you can't use that. Okay, it's owned by another company. And then COMT, which is Certified Orofacial Myofunctional Therapist, is owned by the AOMT as a trademark registration. So you can only use that if you go through their certification process. Okay. Myofunctional therapy is not a controlled act, and as long as you are doing no harm and you are practicing safely, you can do it. Can you put, so, and you have to check with your regulatory body as well, but putting any kind of acronym behind your name and credential behind your name needs to be somewhat, like, for example, in Ontario, the only approved credentials that we can use as registered dental hygienists behind our name are a degree, RDH or RRDH. So that's it. That's all we're really allowed to do according to the CDHO. That's in Ontario.
So you can put myofunctional therapist, RDH, myofunctional therapist.
Absolutely. So and that's what I do. I usually tell my students, like, call yourself whatever you want. It's just know that this is what my college says, right? So you really should, we have to be aware. I say this in my classes too, once a registered dental hygienist, always a registered dental hygienist. So you really have to be aware of what we're allowed to do. A lot of the time.
Yeah, it's really about being trained and educated to provide the service. And it's not a designation like RDH. It's, like you say, it's a trademark from a company that offers this. Otherwise, RDH, myofunctional therapist. It's good.
I think that's the main question that people are asking is, if I take this course, am I this? So after taking your course, are they a myofunctional therapist? That's kind of the bottom line of the question.
Yes, they are. And they can provide treatment safely as a dental hygienist.
Beautiful.
And that's my goal with the program, is that people aren't just taking a 5-hour YouTube course and then doing it in a dental practice. It's important that we do and practice safely.
Perfect. I'm going to let Kathleen take over and wrap up the show. There was just one more question that's simple to answer, and that is, do you feel that if they take the online portion, so your Mysteries of Myo course, do you feel like that provides the individual enough information to know how to refer to a practicing myofunctional therapist?
Absolutely. That's one of the objectives of that little 6-hour piece as well. Not only is it an introduction to understand if they want to continue down that path, but it also allows them to improve their overall assessment and refer if they need to. And you don't have to have a referral to see a myofunctional therapist either. I don't have to have people refer to me. I get people calling me directly as well. So it's not specific. It's not like going to an oral surgeon or anything like that.
Great. Thank you so much.
Wow. What a show today, Joe.
Yeah. It's awesome. Just getting these questions here. Okay, so I guess I just wanted to share your next course, Joe, is on Tuesday, February the 7th, the 14th, and the 21st. And it's a 6-hour, so it's two hours online for 3 weeks. That's a 6-hour. And that is something great to take if you want to just learn more about myofunctional therapy, or if you want to start looking at your clients and thinking I can refer out to a myofunctional therapist, or it's also the prerequisite for the program, which is 30 hours, which starts April 4th. It's a Tuesday night too. It's like Tuesdays with Maury, it's Tuesdays with Joe, and it's April 4th to May 16th. And then in person, Saturday, May 27th and Sunday, May 28th at RDHU, which is our facility in Burlington. And yeah, so it's a beautiful facility. It's a wonderful weekend. And yeah,
just a quick note about the 6-hour program that we should maybe mention it when in the descriptor, but if somebody has in their life, anybody watching, and they want to do the 6-hour program, if somebody has somebody in their life that they want me to look at, I actually request in that program that the participants send me pictures, and I'll tell them take some photographs of your daughter or your husband or your spouse or your niece or a patient even, or your client. We go through some of those as sort of initial case studies to help identify. So
that's good.
To get it a little, we like to get a little personal.
that's the thing is like, even when I was just at your one day, I didn't stay for the 2 days, but the one day was just like, everybody was thinking about all their family members and friends, and they were like running, like messaging them, and we have to do this and you have to do that. Very good.
Great.
Well, I want to say a big thank you for joining us today again, Joe. You have blown a lot of our minds and given us so much information and valuable resources. And, you know, your knowledge doesn't just stay in Ontario, it is across the nation, honestly, and you're making some really great connections. And I'm excited to see your journey and your growth as you really help move the hygiene profession towards and offering the myofunctional therapy. So from the bottom of all of our hearts, thank you very much for joining us again. Next show is going to be with Dr. Joy, and she's going to be coming on February the 3rd, talking about diversity in the office and on your tray. So another one to put down and to make sure you join us next month on February the 3rd.
That's great. And we will send the recording to everybody who has registered, and there will be a follow-up email as well. That'll be like early next week. It'll be in your portal.
Well,
All right.
Thank you, of course, as always, to RDH. You guys are all so kind and wonderful to me.
Thank you,
I
Joe.
got
And
that,
lots
Joe.
of thank yous from everybody. Thank you so
Yeah.
much. It was
Yeah.
awesome. So good to see you. Nice to see everybody. And thanks to everybody for joining us on this Friday afternoon, and enjoy your weekend.
Absolutely.
Take care.
Bye.
Bye.
Thank you. Thank you, Joe. Thank you, everyone.
Thank you.
Bye.